Hello, good morning, everybody. Can you hear me?
Yes.
Okay, I'm going to have to apologize because I cannot get my webcam to work this morning. So sorry for that. You can't see me, but hopefully everything else will work out without any problems. Welcome to the question and answer session for the Quality Improvement Symposium. My name is Crystal David, and I am a clinical pharmacist in the Department of Family Medicine at OSU. And along with Dr. Kathy Cook, I'm also the co-chair of the Healthcare Quality Committee. It's part of CLEAR. And so as you may be aware that as part of the completion for your residency, ACGME requires that you participate in at least one quality improvement project. And so we have a symposium every year as a way to let you kind of show us what you did for your quality improvement project. If you have started on one this year, hopefully I will answer some questions about what needs to happen. And if you haven't started on one yet, we'll talk about that. And I guess the way this is going to go is I will talk about the beginning, like just some of the general aspects of the quality improvement project. And then Dr. Ty will talk about the osteopathic portion. And then at the end, we will take any questions that you all have. Dr. Ty, do you want to introduce yourself before I start talking?
Sure. Thank you, Dr. David. So I'm Dr. Ty. I am glad to be here, and I appreciate the attention and your time this morning. I am the Executive Director of Osteopathic Recognition and one of the OMM faculty over at OSU. My role as the Executive Director of Osteopathic Recognition is basically to highlight and show where the osteopathic components are done. And to be honest, we have such a strong culture, but we don't really see that. And I'm just trying to have a different lens to highlight those areas for you. So look forward to chatting later.
Thank you so much. Okay, I'm going to share my screen here.
Dr. David, as you're sharing your screen, I just want to also add that my portion of it will be interactive. So I'd like some feedback in participations and comments. I'm going to try to poll everywhere. So if you could reply your answers either in the chat, poll everywhere, or you can unmute yourself. Okay. Thank you.
Great, thank you so much. Okay, are you able to see my PowerPoint?
Not yet. There it is. Okay.
Wait, yes, you can?
Yes.
Okay, thank you so much. I've not ever presented from this computer, so it's hard. Okay, so like I mentioned, we're going to talk about starting and completing your project. And then really, this is to give you time to ask questions about how we can help you finish your project. Okay, so what exactly is the symposium? So really, it's just an opportunity for you to discuss initiatives, show us your research and any innovations that you have that are aimed at improving healthcare quality and patient safety. So that's the real focus of these projects. And it gives an opportunity for interactive discussions. So the presenters will stand by their posters to explain their findings. They can answer questions and then engage with the attendees. And then again, like speaking of more opportunities, there are networking opportunities. And so we really encourage collaboration, feedback, and knowledge sharing among the participants. So those of you who are presenting, as well as people who are attending the symposium, to come and talk to you about it. And then judging and awards, of course. So we'll talk about how the posters are judged and what awards are available. So really, like, this is just an opportunity for you to share your hard work and what you've done and let other people see what we're doing in our healthcare system as part of our programs. So this year it's going to be on June 3rd, and it's from 10 to 12 at the Tandy building at OSU CHS. There will be in-person and virtual components. We would really love for everybody to come in person that can. And like I said, it's just for the 2 hours. And so we will print your posters and hang them up for you. And you show up at 10 o'clock and stand by your poster. And then that way, when people are walking around to look at the posters, they can ask you questions. And you can have an opportunity as well to walk around and look at other programs' posters. Virtually, we will host the posters. We'll have like a slideshow of the posters going, so people who aren't able to attend in person can still come and, or not come, can log in and look at them. And then when the awards ceremony is at noon, that will also be hosted online. Okay, so maybe you're feeling a little excited. Maybe you're thinking a little FOMO here, like, oh gosh, I haven't even started yet. Is it too late to start a project? I mean, that's June. This is March. That's 3 months away. Can we still do something? And it's not too late, right? So you definitely can still start. And today I'll talk about a few ways that you can get started and be finished on time. So really, to get started and to finish, obviously you have to take that first step. And then once you do that, you'll really be surprised at how things start going together. So what is that first step? Okay, so obviously you'll need to decide on a project and ask someone that's faculty to be your advisor, and then register to participate. So if there are several of you working on one project, only one of you has to submit this registration. And so I've included the link here. I'm just going to show you what that looks like. It's really easy. Lisa Cummins, you may have been getting emails from her. She put this together for us. And just click, you answer 8 short questions about your project. And that's just so that we know what to expect, because we will need to have the correct number of poster boards available and get things organized for that, as well as like getting judges available. So really, most of this is really easy. Toward the end, you'll need to know who your advisor is. And then on question 7, the credentials and the PGY status of each member, and then the working title of your poster. So if that changes after this point, that's still okay, but just something in general that's going to help us out there. So you may be wondering, like, where do I get this link? And so you should have received a handbook, and it's a quality improvement handbook that we've put together. And if not, later today, we can send out another copy. It'll be the most updated copy anyway, and that would be the one that you need to work from. And if you don't receive one, you can email us to get a new copy. So you're thinking maybe, how do you decide on a project? I bet like each of us have at least half a dozen ideas right now that we could think about, ways that we could improve patient care, the quality, and patient safety. So just start with something that you've been wondering, like, oh, I wonder if it could be better if we did this. And then that's the first place and the best place to start, something you're truly interested in and that you want to see if it'll work. Okay, so here's the handbook. And well, obviously it's not the handbook, it's just a screenshot of the cover of the handbook. But like I said, we go through step by step and talk to you about how to create a project and how to finish it. And if you don't have this email address, it's qualitysymposium@okstate.edu. And Lisa is really the one who mainly communicates via that email, but she's really great at responding to questions. But if you have anything specific, you can email myself or Dr. Ty if it's based on the osteopathic portion. Okay, so in this handbook, just to kind of cover it, we have a table of contents, and we have linked each of the appendices so that you can quickly and easily get to the portion of the handbook that you need. So this is just a screenshot again, but just to show you, we have a timeline for you, a checklist on how to create your poster. We'll even talk about how to determine authorship, how to create the poster, what size to make it, how to create the Zoom presentation, and the judging rubric. And I'm going to talk about a few of these today. Okay, so again, like I said, a step-by-step guide. You can see step 1, which I already mentioned, right? Select a project and contact a QI faculty advisor. And then it gives you a little more information on that. And then step 2, there's that link I told you about. So it's in the handbook. It's right there on the step-by-step guide. And that's the link to click to let us know that you want to participate, which I guess I haven't mentioned is free. We print your posters for you for free. which is unusual for a lot of symposiums like this. Okay, so a couple of things I wanted to mention that I feel come up a lot. One is IRB determination. And so that's the Institutional Review Board. Any research type projects need to go through your local IRB, and they will determine if everything is going like being done in a safe and respectful way for any patients that are involved. I will say most quality improvement projects are exempt from IRB, but you still have to do the application. So you get online and there's the link. Again, the link is in the handbook, and fill out the form, and they will let you know if it's exempt. And then you'll just put on your poster IRB exempt. Now, if yours for some reason isn't exempt, they'll let you know what steps need to happen in order to be IRB approved. So each person needs to have created an IRB account. So anybody who is on your project has to log in to the website. And that's just so that they can be added to the application. But only one person in your group will need to submit the actual application. And if you have questions about this as we're going, you can type them in the chat so that you don't forget them. And then at the end, we'll go back to them. Okay, so again, like I'm saying, this step-by-step guide, and I'm not going to go through every single step. I just wanted to show you that we're there. There's a section called Create an Aim Statement. And in the handbook, we tell you about an aim statement, and then complete a project timeline. We even give you a sample timeline that you can look at. Of course, your dates will be different, especially because if you're just now starting. But it's just a sample to let you know, like thinking about what needs to happen and when it needs to happen. And then number 7 will be a project overview. 8, determining authorship. 9, scheduling those meetings. 10, conducting your research, and then presenting your project. So again, like I'm going to talk about a few more of these that come up more often with questions. Determining authorship order. So I believe Dr. Corbin Walters helped us create this last year, he and a group of other residents. And really the idea is just to make sure that we have enough involvement from each resident to be considered an author on the poster and in the project. So so that way you don't have any last minute joins where they're like, oh, I really need a project, can I join? And you've already done all the hard work, and then they become an author. So you must have a total of 100 points from this chart to be considered as an author for the poster. And if you're looking at that thinking, man, 100 points seems like a lot. I mean, really a lot of these, if you do just a couple of things and you're actively involved, you're going to meet those 100 points pretty easily. So let's say, for example, you're the person who fills out the IRB application. That's 25 points right there. Maybe everybody should be revising the poster. So there's 10 more points. You can just look through here. Attending the symposium and being there is 25 points. So you can see, you can easily get 100 points. The one that's on here that's 150 points is really aimed more toward your faculty advisor. So it's leadership and advisement. And they're the ones overseeing the project and just making sure that the project and the team are completing the tasks. Okay, so let's talk about step 11. I'm kind of skipping around, right? Step 8, step 11, because these are the ones I feel like need a little more information. So Appendix B in the handbook is going to go through each thing you need to do on the poster and how to create the poster. Appendix E will walk you through how to record that video in Zoom, and then you want to attend the symposium. So let's talk a little bit about Appendix B in the handbook, and this is something that's a little different this year if you've participated in the past. Appendix D will walk you through the sizing and has links to the templates. And so here I'm going to show you what that looks like. So this link is in the handbook, and it's some poster templates. Hopefully this works. Okay, so it'll link you to a Gmail drive. So you have access to this Gmail drive. You cannot edit them, but you can access them. So if you double click on it, you can pull up, it'll have 2 PowerPoint slides. The first one is instructions, right? Telling you, download this PowerPoint before making changes. It tells you how to name it and then lets you know, like, you can change anything you need to on the next slide. You can increase and decrease font size. You can change colors. You can move things around. The only thing you cannot change is the size of the slide. So I've already made them the right size for our printing. So please do not change that. But once you download this file, then you can take this page and you can do whatever you want to it, right? Like obviously you're going to change it to be like super awesome QI project. And then you'll include your authors, your faculty advisor. Make sure when you put your authors in here, you're putting your credentials, right? So DO, PGY2, and we need that information. And then you just double click in the box and you can change and put your background in there. I put each section in there to tell you what needs to be included in the background. So you don't have to go and find that in the handbook when you're making your poster. Again, you can delete any of these. These are just samples to show you what things you could include in this results section. So change those out, put yours in, make it bigger if it's something that you really want people to see, right? So you have lots of room to do what you need to do. And this is just what you're starting with. And then on the bottom right, you can see there's a purple square. And I want you to just leave that purple square there because that is where we'll put your QR code that will link back to your video. Okay, so again, you can change anything. If your aim statement doesn't take up this much room, right? It takes up this much room, you can move your methods up, right? And just make sure it all lines up again and then increase that. So feel free to change anything on here except the size. And of course, we'll still want either the OSU or the Omiko logo here. Plus, you can add your own program or site logo there. Okay, so I changed a few of them for colors for you already, just so that everything wasn't orange and black. So if you wanted a blue and black one, you can change them and create your own. You do not have to use these templates, right? You can use your own. If your institution has one that you already prefer to use, you can use that as well. This is just to help you in case you don't have a starting point. So when you link to when you link to them here, and that'll let you open them, but to download them over here on the right, you can see the little download icon. Download it, save it, edit it. Okay. And then again, here is kind of an example of how we'd like you to name your project. All right, so onto the judging part. Appendix G is where the information about judging is, and there is a rubric there, so there are no surprises. You know exactly what you're going to be judged on. There are 65 points possible for the general rubric, 13 categories scored from 0 to 5. And then in the end, the judges will compile their scores, and first place is $1,500, which is really generous. Second place is $1,000, and then third place posters will get $500. So like I said, very generous awards, and just another reason maybe to encourage you to want to participate this year. Okay, so that is it for my presentation. I see there are some questions in the chat. I'm going to let Dr. Ty go ahead and do his portion, and then we will answer the questions after we've finished.
Great. Thank you, Dr. David. So after Dr. David gave you that overview, I'm going to talk about how are we going to look at it slightly different to integrate our osteopathic principles in practice. As a reminder, your osteopathic tenets, the first one is the body is a unit, mind, body, and spirit, essentially meaning that all of our systems within our body, the heart, the lungs, the kidneys, are not independent of each other and are interconnected. The second tenet is the body is capable of self-regulation. We as physicians typically see them when there is dysregulation or dysfunction, and we provide the tools and the resources to optimize the body's self-regulation and function. And the dysfunction can lead to impaired structure and vice versa, leading to our third tenet. The last tenet is the rational treatment is based on all three, essentially meaning that we take everything into account as the person as a whole. This is the osteopathic rubric. We have three main categories: the background of the project, the practical application of it, and the OMT. Total points of 0 to 4, maximum of 12 points. And we'll get a little bit further into it. But first, we're gonna watch this role play video. So Dr. Sheldon Cooper is the physician interviewing Miss Penny, who slipped on the bathtub and injured her shoulder. As we watch this interaction, think of how the osteopathic tenets are implied or where it could have applied, and I'll ask you to share with the group.
So right when I thought Mom had started taking it easy with her osteoporosis, boom, we moved to this cool new place and this.
We have to fill these out. Describe illness or injury.
I dislocated my shoulder.
All right. And how did the accident occur?
You already know that.
Cause of accident, lack of adhesive ducts. Okay, medical history. Have you ever been diagnosed with diabetes?
No,
Kidney disease?
no,
Migraines?
getting one.
Are you currently pregnant?
No.
Are you sure? You look a bit puffy.
Change migraine to yes.
When was your last menstrual period?
Question.
I'll put in progress. Moving to psychiatric disorders, list all major behavioral diagnoses, e.g. depression, anxiety,
Oh
etc.
my God, what the hell does it have to do with my stupid shoulder?
Episodes of subpsychotic rage. Possible Tourette's. Any moles, lesions, or other skin conditions. Suit tattoo on right buttock.
Sheldon, look, I am scared and in a lot of pain. Could you please take a break from being you for just a minute and try being, I don't know, comforting?
I'm sorry. There. Everything's going to be fine. Sheldon's here.
Thanks, that's much better.
Oh, well, hope you enjoyed that funny clip. During that interaction, were there any osteopathic tenets that stood out to you? You can share in the chat or unmute. If there's not any responses, then I'll just see if someone would like to participate. Dr. Walters, what are your thoughts?
I think it's a very good scene of us that we have to remember where people are coming from, and everybody answers questions in a different way, asks questions in a different way. It's trying to find somewhere in the middle that kind of gets to the heart of the matter.
Thank you. I mean, there's some parts of me that I feel is as going through the process and learning and interacting with patients and people, it's that practice, right? And to me, I see the first tenet, that mind, body, spirit, with our attitude, her mood, basically is being impacted by her pain. Now, as a potential QI project, I'm also looking at this interaction and thinking, well, will getting faster care lead to less complications? And there are some questions in there that may seem very random, but are very helpful in our evaluation, and that adds to the fourth tenet, such as how does asking if she has kidney disease or if she's pregnant help her care? This may impact the images that you decide, the pain medications, or any medications overall as she is recovering from this. Following this, how will this injury, medical visits impact her care, impact her persons, impact her story, her mood? Can she potentially develop some anxiety from using the bathtub, or anytime she's walking on the slippery surface? Or was this injury an indicator of something else? So just some potential ideas there, because as we're going through the background of the project, as Dr. David had mentioned, we're just looking at what is important for the osteopathic portion of it. The presentation, the posters are very limited size. So I'm not expecting all these components to be within the poster. So you can see in the rubric, it'll say the poster and or presentation. And so as you are presenting, you're giving your Zoom presentation, you can interject where the osteopathic components are relevant in the background. If you 4 points for at least 3 of the 4 osteopathic tenets, and then 2 points and 0 points, there's definitely options in between. What are you trying to accomplish? What is the big goal in this quality improvement project and patient safety? Some of the common areas that we're working on is we're trying to improve the workflow, reduce any waste, reduce healthcare cost, improve screening, improve patient compliance, and improve patient education. These are just some big topics that cover a lot of our smaller if questions that Dr. David had mentioned earlier. Practical application is, how's this information going to help your patient care? Okay. Because what is the problem? What is the medical condition that is being addressed? And how does this impact that patient? What are the potential barriers to optimal patient care? So we're going to do a quick poll everywhere and see if that works. So if you can scan the QR code, I'll leave that instructions up for a second. Or join the web or text. What are barriers to optimal patient care? What are things that you see? What are things that you have encountered? What are some barriers that you foresee? Wow. It's looking great. Time, transportation, language, education, literacy, communication, support. Now, all of these are even more unique given where our programs are, working with Oklahoma and rural Oklahoma, where some of the resources are a bit more restrained, restricted. Okay, even the places in Tulsa, what are things that we can do and what we don't have? Thank you so much for the responses. This is great. Let me switch back to PowerPoint. So we talked about some physical barriers, travels, maybe some limitations of the body. How about social, language, and cultural, emotional issues, some fear, stress, anxiety of their condition that they have, of the treatment that they may go through, the procedure they might have, financial, that's a huge burden right now. Out-of-pocket costs, healthcare coverage, healthcare deductibles, is the coverage going to be sufficient? So after identifying the what and how it will impact the patient, we're going to take a step back and see the person, this problem impacts. Because this person has a name. This person has a story, has experiences that have shaped who they are today. And each one of us is very individual. So here we are trying to provide the care to this person and recognizing these barriers and finding these, trying to do what we can to reduce these barriers by having these QI projects. What can we do to reduce the workflow or improve the workflow, reduce the waste, healthcare cost, improve screening so we're getting more patients seen, so better health, more preventative, improve patient compliance. If they're more compliant with the medication, their care, their health, there would be less complications and they could be reduced healthcare costs. And this all kind of intertwined together. Okay. So how can they take care of themselves, or how can they seek care? So even after we're looking at from our interaction to them, I'll take a step further and say, what else can they have problems with after we provide that care? Okay, can they pay for the medications? Are there transportation issues that we talked about? Do they understand the aftercare summary that we gave them? No. The last part is that if you included any OMT techniques or mentioned any of it, there are some points in there. Mainly just saying, how could this benefit the patient if OMT was to optimize their body and their health? So working through that structure and function component and helping that self-regulation. You don't have to do any of the OMT, but if you do, that's great. You can just include, if I did some rib raising, if I worked on the chest, if I worked on the diaphragm, or they did some physical therapy, some increased physical activity, it takes some stress off their back, and then how that could help with their diabetes or whatnot. So you can see how that snowballs down. Okay. So I hope I cleared up that lens, the osteopathic components of it. Got three brief categories: the background, the impact, and the OMT. If there are further questions, or we'll take questions now, but if you come up with any questions later in the future regarding the QI or any of the osteopathic components, I'd be happy to help if I don't have the answers myself, and direct it to someone who may be able to. So let me unshare and I believe one of the questions for Dr. David and I is, can you provide some details on the IRB application process, including key steps, common challenges, and best practices for approval?
Yeah, I'll take that one. Thank you. So I feel like IRB people feel a little anxious about sometimes because you may not have ever completed an IRB. And so I went ahead and clicked on that link. Let me share my screen here. My screen's a little overwhelming probably at the moment. Okay, so I clicked on the link and here's what you'll come to. You have to create the account. And once you've opened that up, over on the far left over here, you can do new IRB application. And then it tells you what to go through. So it talks about city training. You most likely will not need to do city training for a quality improvement project. Anyway, you can see here, title of the project. So that you should already have from your submission on your intent to participate. Proposed start date. So technically you are supposed to fill out this IRB application before you start your process. If anything has been different, I think you can go ahead and change that date there. And then here it tells you that, okay, so if it's IRB exempt, it requires one person to review your application, and it takes, excuse me, 1 to 14 days. Usually it's pretty quick turnaround. I would say within a week easily. You'll receive the email back saying that your poster or your project is exempt. And then, so here we go, principal investigator. And so I have had a few questions from different residents on this, like who is the principal investigator? So this is one of you, whoever is, I would say like the lead person on your project will be your principal investigator. And again, like you have to have already had them create their account so you can add them in via their email address. And it's really not that it's not that big of a deal. So whoever is the one who is submitting does not need to be the principal investigator, but it can be. But here you'll put who it is. And then we'll need like a phone number. And then the principal investigator, click, resident. And then down here is where you can add co-investigators. And so this is where you would add everybody else who is on the project with you besides your faculty. So faculty advisors do not need to be added as principal investigators. I believe once you've added residents to this and started the process, it will have a place that pops up that you can add a faculty advisor at that point. So if you have 1 or 2, however many, you would add them to this. And then down here, you would pick your campus and the department, and then just kind of fill out this. There's not a lot of details about the actual project yet, right? They're just wanting to know what's happening. And then at the very bottom, I guess the next screen, there will be a place, and it won't let me go next without filling in all this required things, but there is like a text box where you can describe what you're going to be doing. And so that's how you would submit that form. And if you have any questions, you can email them or call. And on the website, I don't know if on this one, but if you go to like the CHS website to the IRB, then you can see where like the phone number and everything to contact the IRB department. Okay. If that didn't answer your question, Dr. Lee, you can add to that in the chat for me. I think there was a second one.
The next question is the IRB just for the symposium or for QI projects overall?
Oh, great question. Okay. So actually it's for QI projects overall. So anytime you're going to be doing any kind of quality improvement or any kind of patient research related things, you need to fill out the IRB application. And so we are just modeling for this QI symposium, we're modeling for you and helping you learn the steps and the processes to do so that when you are no longer here at OSU and you're at your new place, you'll know what's needed. So anytime you're wanting to do a quality improvement project, it's best practice to submit to IRB just to make sure that you are within the guidelines of what is, like safe, that you're keeping information secure, that you're doing everything you need to do to cover as far as HIPAA and all that kind of stuff with your projects. And so I would always recommend that you submit an IRB application to your institution or your facility, just to make sure that it's either exempt or they will want you to do that city training depending on what you're doing. Trying to think if there was something else I wanted to add to that.
The
But yeah, it's best.
IRB committee is very, very helpful and responsive to questions and emails. And not only with the QI projects, but they, as you need your IRB, if you're going to write or submit a journal application, basically anytime you're doing research regarding patients, you need to run it by the IRB. Dr. David, you ready for the next one?
Yes, I am. Thanks.
Can you speak a little more on what the video needs to include?
Okay, good. Yeah, I probably should have included a slide on the video. So here, I have the handbook pulled up. You can see like Appendix E. I'm gonna click on it and show you just how easy it is to get there. Okay, so Appendix E, recorded Zoom presentation. So we want everybody to record this presentation. And this is really, there's a couple of reasons for this. One is, so anybody who can't attend in person can watch your video because they won't be there to ask you questions in person. And then others who might be looking at these later after the symposium is over can go and watch the videos. And so it's just a way for you to explain what your project is about, add value to it. So like Dr. Tai had mentioned with the rubric, it doesn't have to be written on your poster. That's going to be the highlights and the most important aspects of it, but what you're going to talk to about your poster. So this would be kind of your, what they call like an elevator speech, no longer than 5 minutes, and really just highlighting what's important. And please do not just read your poster, because we can all read your poster. So we want you to add to it. What value can you add by explaining what you did or what you looked at or why you were really interested in it, and then how the outcome, like what it was. Like you can say those things, of course, just don't read it to us. Tell us in your own words, and then add to it any extra valuable things that you think the audience would want to hear. And so here are the step-by-steps on how to record it. And I'm not going to read them to you, but you just click follow through and do all of these things. And then you would email us that MP4 file in the end. And of course you can re-record it, right? If you listen to it and you don't like it, you don't have to have your picture on there. The screen, the background of your video will be your poster, and then you'll just be speaking to your poster. Thank you.
Thank you, Dr. David. If you don't mind, I'm going to add just a little bit more. So when we talk about in-person, other people being there, the symposium is planning on having this in conjunction with the graduate medical education quarterly meeting. So program coordinators, program directors, your faculty, anybody that will be attending that will be having that, I guess, foot traffic to look at your posters so they can see what's going on with other institutions or other programs. And you can also see what's going on with other programs. In addition to administration and leadership will also be there too. So they'll be good to see how what you've put together and sharing it with others. Thank you. Are you able to present, or are we able to present on 2 QI projects during the symposium? What can we expect on the day of the symposium?
Okay. Yeah, you can have more than one poster in the symposium for sure. I would recommend, if you do, that one of your other colleagues stands up one poster while you're at one. So that way there's somebody at each poster. Ideally, that's what we would like to have. But yeah, we would encourage you to be a part of as many projects and to present those projects, as many as you want to be involved in. And then what to expect on the day. So Dr. Tai talked about that just a little bit, I guess, like who all might be there. We will have all the posters already on the boards for you, pinned up, so you can come and we'll tell you which poster number you are, and you can go and you'll stand next to your poster, and we'll have all kinds of people walking around looking at posters and asking you questions, and then you can also take turns and walk around and look at posters as well. And then at the end of that, we'll have some snacks, I think, or maybe lunch, and then the awards ceremony. And as he mentioned, the additional people that will be there as part in conjunction with this presentation. Did you have anything else to add to that, Dr. Tai?
I just kind of adding with the previous questions, when you're recording or doing the presentation for your video, how could you interject the osteopathic component to mainly help the judges, right? Because we want to be as clear as possible. So the background information, for example, I'm doing a project on smart phrases on tobacco cessations, and hoping to catch as many patients as I can. This way, it'll help with early prevention, and now the osteopathic component from there would be early care. And so trying to interject that early, or excuse me, interject that and be clear so the judges can know, hey, this is a component that's being talked about. You don't have to be having a separate section for all of it, but you can have like little tags here and there throughout your presentation.
I'm glad you mentioned that. That made me think of something else. The judging is done before the symposium. So the judges will they'll receive a copy of your poster and they'll watch your Zoom presentation. And that is what you're being scored on. So judging won't be part of the in-person component. So that's something to definitely keep in mind.
And this other question, can you send this link to us after the grand rounds? I believe, Lisa.
Yes, I will do that right after this meeting. And if anyone has any questions, feel free to send me an email at any time or give me a call.
Thank you. Could you talk more about the authorship points and how we use them to determine authorship?
Okay, yeah. So let me get to that page. Okay, so it's going to be here on the right. I don't know. My screen is very strange to me right now. Sorry. Let me get back to that. Okay. Okay, so I talked a little bit about it. And really the idea is we just wanted to make sure that that it was a team effort, that everybody is putting in some effort to be included as an author. And so again, like I mentioned, the 100 points to be considered an author, but really in the end, what you'll do is you'll use these different components and calculate your points value. And that's how you would determine the order. So whoever had the most points would be considered the first author typically. And then the second points would be second. So that's how you would list them in order of on the actual poster, so that it's not alphabetical or just random. Whoever is putting in the most time and has put in the most attention to the project would be the person listed first. Now that's excluding your faculty, right? So your faculty advisor would be on their own line by themselves and they would not be listed in that authorship order. Most likely whoever your principal investigator is, the person taking charge of the project, may or may not actually end up being first author based on this point system, just depending on what all ends up happening. And this is only our second year to use this. And so I think, you know, we've edited it a little bit from last year. And if there are any things that come up as you're going through it as a resident and you're like, oh, this doesn't make sense, or what about this part? Someone did this and this really took a lot of time and it's not included. We would love to receive feedback from you this year so that we can continue to improve upon this to help make this process make more sense and be easier for you all.
Thank you, Dr. David. I think that was the last questions. If it's okay, I'm just gonna add one little plug for the osteopathic components. So the award for the osteopathic, separate from the first, second, third place of the quality improvement project, is $500. It has been raised from $250 last year to $500 and generously donated by Omiko. Now, want to point out that we are the only program or institution that I'm aware of that has any osteopathic rubric or integration, let alone award, in their QI project. So you're already doing the work, you're just looking at it from a different lens, and you get awarded for it. So if you have any questions, feel free to reach out to me, and or Dr. David, Lisa, anybody on the QI Symposium staff. That's all I have, Dr. David.
Yeah, I don't think I have anything else either.
Any further questions? I think that's it, Dr. Alexopoulos.
Great. I'd like to thank Dr. David and Dr. Ty for giving wonderful presentations this morning. We hope that these presentations can help you develop your posters. We are really encouraged. This year we have to date 26 posters. 6 are coming from outside of OSU Medical Center. And so we encourage all our sites in the consortium to participate. It is not too late, and we are here to help you get this done from concept to completion. Again, we are here for you. We'll be sending out the link so that you can share it, your didactics at your particular sites, and we look forward to working with you, and hope to see you all in person or virtually on June 3rd. So thanks very much, Dr. Ty, Dr. David. Have a great day, everyone.
Thank you, everyone.